thinking about sensory stimulation, which is primarily what we're doing, there are areas where the body has more sensory receptors and a bigger variety of sensory receptors. And this picture here, this wonderful thing here, we've got sensory and then we got motor. So in the nervous system, we don't directly interact so much with the motor, which means the body from the brain down is doing something. It's telling something to contract or something to relax or something to move. We stimulate the sensory nervous system by moving something, by touching something, by pressing on something. A big beneficial aspect of massage is hyperstimulation analgesia, and along with that, counter irritation. What both of them mean is that during the massage, you're putting a lot of sensation into the body, and it's overriding whatever symptomology the person's got. So how many of you have used something like an icy hot or something, and it's never going to fix anything, right? But what it does is it puts a sensation into the surface receptors that it tricks it into sensing first cold and then hot. It's usually a menthol-based type thing. So your brain has to pay attention to that, and it doesn't pay as much attention to anything that's underlying in there. So if somebody is having a persistent sensation someplace, there's really no pathology underneath there, or it's not an easily corrected pathology. It's in a joint. Things like heat, cold, menthol-based ointments, those kinds of things can manage symptoms, especially helpful with them getting to sleep and that sort of thing. When we're doing massage, regardless of what your outcome is, regardless if you're looking at well-being, relaxation, general all over feel better, or you're looking at stress management, they've got some symptoms now, they're not sleeping so good, or they got a headache or whatever. Pain management, you use this concept of hyperstimulation analgesia and counter irritation a lot with pain management. If they got general systemic pain, like a fibromyalgia-ish type thing, or a rheumatoid type pain. Anybody knows anybody with fibromyalgia or something like that? They ache all over. The stimulation, the novel stimulation, is what's going to give them the relief. And you've got to vary that stimulation. It's got to be, you want to close the door. I'm awful about being distracted. You want to make sure that you use lots of different pressures and lots of different movements, because it's the novelness of it. You can use pinpoint where it's a good hurt. You can, especially if it's not actually where the body might be injured, like on the feet. You can use good hurt there. So we want to look at the sensory. In our brain, we have a sensory and a motor strip. Looks like a headband that goes through here. These are not necessarily proprioceptors. Proprioceptors also are processed in the sensory motor areas of the brain, but they also process through reflex and vestibular stuff and all of that. We access those more when we move the body. We get into those kinds of things. So if we've got a goal, we have a client that their main outcome is well-being, but they're achy. They might have maybe they over-exercised or something. They got a little delayed onset muscle soreness. They're kind of achy. Or they've been in physical therapy or chiropractic and it's been kind of intense for them and they need to just back off of that a little bit. Or if the person can't get a full body massage for whatever reason, they may be bedridden. They may be recovering from a medical procedure. They may not be feeling very good. Maybe they're 2 or 3 days post chemotherapy treatment. They're achy, but maybe they don't have the adaptive capacity to get a full body massage. Maybe you just want to sell a 30-minute session where people don't have to take their clothes off. So if we look at this picture, you can see these 3 areas: the face and head, the hand, and the foot take up most of the space on this. So it makes sense if we're looking for that sensory stimulation, that's going to be our goal, is to just flood the system with novel, feel-good sensation. It would make sense to put it there. What I get frustrated with is many times people will spend way too much time on the back. Like I think you mentioned your husband, and they want excessive pressure there. And part of that is they have very little sensation. They don't experience a lot of stuff there. They don't have a lot of cluster of nerves in that area. And you have to get down deeper into the tissue and almost elicit the pain response, the nociceptive response, before they feel like you're doing anything there. And now you can do things, and when we learn more about hydrotherapy, hot and cold and suction cups and things like that, you can do that to give them a more intense sensation. Well, we talked about earlier, how we can just narrow the contact or something. And it's always just in that one area pretty much that people want more pressure. So keep this in mind. And because a majority of your response for relaxation and well-being is going to be from this sensory overload, we don't want to skimp on those areas in the general massage. So don't do so much on the back. How many of you found that in your practice? You get stuck on the back. And that's where people sometimes feel like they need something, right? So, but you're better augmenting. Like put some icy hot on it, but do something along those lines. Put a hot pack on it so that they feel like something is being done in the area. This picture right here, I'm just pointing it out because I'm on it. You can pretty much tell what a muscle is doing by the shape of the thing and how, whether it's going up and down or back and forth or on a diagonal. So as you just pay attention that page is there and it's important. I want to show you the head. Ta-da, a head. So turn a couple of pages and you'll find it. There are things called intrinsic muscles or tissues and extrinsic. Intrinsic means they're all in one area. They don't cross multiple joints. So the muscles of the face don't travel down into the chest except this platysma thing. The muscles that are on the scalp, the part of the scalp, they're right there. But you can see where there is a connection where the muscles in the back and the side of the neck are rolling up into the skull, and they overlap, they make a seam, they hold hands with each other. So if I'm thinking about affecting the head, I have to think about the extrinsic connections, the muscles that are from another part of the body that are coming in. So these muscles of the scalp and then also of the jaw, they're really strong. The ones that are actually part of the face, they're a little bit more delicate, but they're directly connected to the limbic system, interestingly. So they pick up on facial expression and what your emotions are with that. So there's a lot of overlap in how we experience things. So when we're going to massage this area, we need to make sure that we are addressing these muscles here at the back, the structures, the connective tissues here at the side, and here in the front. Those are the location of a lot of tension headache. But we also have to take a look at the structures that come from the torso, the neck, and come up into the area. The jaw, the TMJ thingy that people talk about all the time, you want to make sure that you get this structure here down into there. That's what we're thinking about in terms of positioning. So there's the head.